And with that, while we're changing the panel here up front, I'm going to introduce Dr. Ioma Eneli, my co-chair for the workshop here. Ioma is the vice chair of the Roundtable on Obesity Solutions, and she is going to provide us with some closing comments and remarks. She's a professor of pediatrics at The Ohio State University, director of Center for Healthy Weight and Nutrition in the Division of Ambulatory Pediatrics at Nationwide Children's Hospital. Please join me in welcoming Ioma.
Thank you, Dr. Pronk. And I will pull up my slides. Share. It's been a long day, but a good one, I think. It's very enriching. We had an excellent group of speakers, very informative. And I am actually thrilled to be going last to do the wrap up. So, and I will do it so that we can get you out in the next 10, 15 minutes. So the last panel was great. I think that was a thoughtful discussion on the practical implications of what we talked about all morning, how you look at BMI measures and the definition of obesity in healthcare, in public health, and even in the legal field. And there's going to be more to come on that at our next workshop. So I hope this workshop will serve, will serve as a conversation starter for you when you go back to your organizations or with friends, family, and really any space, because I think this touches each and every one of us, whether you're 2 or whether you're 99 years old. So why did we pick this topic in terms of our key takeaways and next steps? That's because there is already a lot of discussion on this topic, on BMI, whether we measure it, the definition of obesity. And as you can see from this, what I'm showing you up here, there's a wide variety of experts, right? Good Housekeeping has a topic on it, has a whole article on it. Washington Post, New York Times, I mean, this is a hot topic. So this is the right time to do a workshop at the National Academy of Medicine Roundtable on Obesity Solutions. There is a Lancet Commission, and I know some of us in the room are members of that commission that's going to look at this topic from a scientific perspective, but also layering in the lived experience. So there's going to be more to come on that, and that's just been pulled together, and we're excited about what will come from it. So what has our workshop explored? We've looked at the science and the measures of body composition and body fat distribution. And our focus has been on the strengths and limitations of body mass index as a measure of adiposity and health. We've also looked at the utility of alternative measures, right, to assess obesity, morbidity, and mortality. And then the effect on prevention, treatment, and policy. So that's what we've achieved today. And what is agreed upon? We all agree that body mass index is a surrogate measure of body fat. That is agreed on. And there are some strengths to it. It is simple to calculate, to get. It's inexpensive. It's non-invasive. It's been studied extensively, so people are more familiar with it, right? Dr. Art talked about that. And it can be helpful as a screening measure. Higher levels of BMI do correlate with body fat because we're all interested in body fat when we talk about health. And it has served and continues to serve as a standardized and objective measure to guide treatment recommendations, our insurance or insurers that for reimbursement, but even for clinical trials, right? You're looking at objective endpoints for your clinical trials. And in pediatrics, we use it to track growth. And for us, it's not just about the higher end of growth. We're also really interested in the middle, but also the lower ends of growth. Well, what are the limitations? And these are just some. It is not a direct measure of body fat. More importantly, it does not capture fat distribution. It can't tell us the difference between lean body mass and fat mass. And that's important in setting groups in the population. The association between BMI and fat varies by ethnicity, by race. And it's not ideal metric when we think about cut points. So why did we pick 25, 30, 40? It's not clear to us that we have good enough evidence to have picked those cut points to define obesity as a disease. And the changes in BMI is not always consistent with changes in body fat. And I think everybody who's had a bariatric patient here post-surgery can attest to that. There is a flawed interpretation of this measure in multiple sectors. The way our patients define or understand it when we talk about it in healthcare, by employers, public health. But more importantly, or perhaps most importantly, it does drive bias and stigma. And that is key because we have that element of discrimination and the impact on health. So what do we know? We know that body mass index measures body size. It does not measure body health, and it does not measure body fat. But adipose tissue and fat is the key. That's one of the things we learned from a number of the speakers today. It's about our fat distribution, which can be visceral, atopic, versus subcutaneous. We're very much aware that where we carry fat has a genetic predisposition. It can be affected by our biology, by our hormones, which again speaks to that idea of personal responsibility or willpower, right? I have no control truly on where, or very little control on where I'm carrying my body fat. And fat distribution also varies by ethnic group and age, which is why we see different prevalences of comorbidities in different groups. Visceral fat, we're told, and atopic fat, like in the liver, right, is the major culprit for metabolic disease, unhealthy obesity. And there is some correlation between our visceral fat and BMI, but whoa, it's not impressive. We've learned about adipocyte size and dysfunction. The bigger the size of the fat cell, the more likely it is to perform in a dysfunctional way. And the higher your level of dysfunction of your fat cells, the more likely you're going to have health impacts, which is why I have patients who have a BMI of 85, and I get their lab results and it looks pretty neat. Really nice cholesterol levels, much better than mine. So we have to be able to go back and look at the science between fat and our definition of obesity. There are alternate measures, and we heard about them. We heard about the cost, and some of them are listed. The digital anthropometry may be very promising, and I am going to go and download that app and take a look at it. But we've also learned that the idea that it's an alternate measure to BMI doesn't mean it's the way to go. And if you've ever been patted down at TSA, you have a little bit, just a glimpse of what a waist circumference can look like in clinic. So what are the considerations that this excellent group of speakers have put on the table? It's the definition of obesity, looking at cut points. We need to look at that. What's our interpretation of BMI and the alternate measures? What do we truly know about adipose tissue physiology and pathophysiology? And how does that help us define this condition? And where are those potential opportunities that every speaker talked about: the bias and stigma, the lived experience, the cultural implications from our anthropologists in the morning, the cost, which is very nicely laid out. We have to make sure there's no insurer in the group, in the room, seeing that. The communication, what is the perception? How are we communicating? Our policy, public health, healthcare outcomes, physical and psychosocial health. So I think that point, that we're not just talking about cardiometabolic health, we're talking about everything that affects our quality of life. Because after all, health is not merely the absence of disease. And then the areas of tension: do we throw it out? Do we keep it? If we keep it, what should it look like? Those things were discussed. And then finally, I thought it was really interesting to talk about the inequity in the workforce, right? And the impact and how we measure, and looking at it as a work as a social and economic determinant of health. So a couple key takeaways. We've agreed that BMI is a surrogate for body fat, measure of body fat. The World Health Organization, right? World Health Organization defined obesity as the condition where excess of abnormal body fat impairs health. I think for now, that seems reasonable for us to think about that as the way to go forward, and then explore it for all those considerations that we raised at this workshop. And in January, the American Academy of Pediatrics put out their new guidelines, and they actually use that. So the first key action statement talks about screening. When it talks about the BMI or BMI percentile, it uses the word screen. And the second key action statement, which follows that, talks about evaluation. So it takes away the idea that it's just the BMI percentile that you're using for your definition, and then wraps other conditions or the risk factors around it. So I thought that truly goes along with our WHO definition. So the question for us in this group is, do we throw the baby out with the bathwater? Is that something we should do? What do we lose if we do that? Very much, you could lose this. This is the upside, same baby at one. Gorgeous baby. Now I had a picture of her crying, but she just looked as gorgeous, so I didn't put that in. So, and that's the downside, right? And that is important because I want to invite you, everyone in the room, everybody online, to our next step of this journey, which is our second workshop on June 26th. So I have October, which is wrong, gotta change that. But June 26th, we'll do a part 2 of this workshop. And part 2 will truly look at potential strategies and future solutions. So we'll have, again, an excellent panel of speakers who will talk about improving communication about the body composition, BMI, adiposity, and health across diverse groups and sectors, including strategies to mitigate disinformation and misinformation, and also look at current evidence gaps, and then potential next steps that can advance the field in whether it's research, clinical practice, public health policy. So I'm excited for what the June workshop will bring. I think it's going to tie this up really nicely. And I invite you to join the roundtable on obesity solutions in June for that workshop. And then finally, I would like to again go back and thank the members of the planning committee for an enormous amount of work and an excellent workshop, to all our speakers, and to everyone who joined us today. I hope it's definitely been a worthwhile experience. Thank you.